What is more important to us than our health? A question that's never easy to answer. And in today's modern world of emerging discoveries, research in healthcare and medical treatment is full of promise and hope. Leading research is conducted in Israel and, of course, right here in the United States. One such company is Neostem, an international biopharmaceutical company and one of the leaders in the area of therapeutic and diagnostic applications of adult stem cells for medical treatment. Dr. Robin Smith is chairman and CEO of Neostem, and she'll update us on this very encouraging subject. Later in the program, we have an exclusive interview with one of the world leaders in scientific medical research, the Director General of the Hadassah Medical Organization. Professor Shlomo Mor Yosef will join us later in the program, but first we have these messages and a video.
Being in a small department allows me to experience lots of things that I would never get to do at home. I work with a great team of doctors back home, and they just don't have the capability to allow me to sit in while people are doing echoes to look at the heart, or there's cath lab and you're right there and it's all in the same department, and so you get to see so much while you're here that would be very impossible unless you're a medical student at home.
I found this program and I found Masa actually through my birthright trip. 10 days is not enough. The amount of ideas that come out of this country, I just knew I had to be a part of it at some point.
I instantly fell in love with this place. I've traveled all over the world and have never felt the need to immediately come back to a country before.
Real Life Israel was very great at placing me with my internship. I didn't have any prior connections in Israel. I told them what my background was, what my capabilities were, and they hit the nail on the head. I'm working in the immunology department. I'm doing research.
Being here and being able to work on the cardiac amyloidosis program and learning more about it is an amazing opportunity for me. Just being able to work in a center that sees these patients and allows me to learn more about them in such a small niche within cardiology is a great experience.
This internship has proved to be everything that I wanted it to be. I think having this experience will make it better for me. It's going to be such a boost to my resume.
The best part so far has been my relationship with Dr. Pollack. He makes it so easy for me to ask questions and learn, and challenges me to figure out things on my own.
And we find it very rewarding because we like teaching. It's a teaching institution. And we do want to spread knowledge and to learn from our pupils as well. I was very happy to have Jenna here because she can bring us some of her experience, knowledge, and expand our ability to actually treat our patients back here.
Coming to Israel, especially to Jerusalem, is an adjustment. I think anyone would lie to you if they told you that you come here and oh, I'm an Israeli already, because the culture is so different here than anywhere else.
Yes.
We started going to the shuk and we started walking places and being more comfortable getting on the buses, and slowly over time we've eased into the culture, and it's made such a difference in our experience here.
Oh, it definitely has. Now I'm starting to feel like an authentic Nachlo resident in Jerusalem.
Masa helps out most of the participants by offering different grants, and that made a huge difference in my decision to come here. Without their grant, I definitely wouldn't have been able to afford, being a 20-something in an entry-level job. It's difficult financially, but with their grant, it gave me the ability to come here. It made a huge difference in my freedom here.
If anyone was thinking about doing a Masa program, I would tell them to stop thinking and start doing it.
With us now is Professor Shlomo Mor Yosef, the Director General of the Hadassah Hospital in Jerusalem. Sir, it's a real pleasure and privilege to have you on the show.
To me as well.
Tell us, sir, what are the challenges facing medicine and your hospital in general in Israel at this time in history?
Hadassah started 100 years ago, and they decided to build a healthcare system in Israel. So every generation there is a different challenge to Hadassah and to medicine all over the world. So for us in the hospital, the challenge is really to bring the best healthcare service to the citizens of Israel, which is a cutting edge of technology and a cutting edge of knowledge. This is on the clinical side, but we also are very much involved in education. We have medical school, we have school of nursing, dental school, school of public health, and occupational therapy. And just recently, we introduced a military track in our School of Medicine as the government asked us to do it as part of our mission as a Zionist organization. And the third part is research. Today, there are so many innovations all over the world, and especially in Israel. And we try to put it in a structure of research done by physicians, and in order to find solutions to diseases, not just to increase the knowledge in the world, but really to find solution to specific diseases. So this is what we do right now when we are one of the world leaders in embryonic stem cell research. And we chose to treat the brain, Parkinson, MS, Alzheimer. The eye is part of the brain, and macular degeneration is the main cause of blindness in the world. And we decided to concentrate on this. And 2 years from now, we hope to start the first clinical trial in the world in which we use embryonic stem cell in order to treat patients with blindness. So this is just few examples. And really the main challenge is to go to what is called personalized medicine, in which you adapt the treatment not to a disease, not to breast cancer or prostate cancer or brain tumor, but to do it to a specific patient, to patient A with breast cancer, who is obviously different from patient B with breast cancer. So today, with the knowledge about genetic of the patient, of the individual, genetic of the family, genetic of the tumor, and when you put all this together, you can differentiate it between patient A and patient B. So what does it mean? It means that we can tailor the treatment to a specific patient. And sometimes to say to a patient, you don't need this treatment, it only causes you side effects and not real effect. So this is, as I see, the challenge on the global medical activity. Our own challenge is to build the campus in Jerusalem in a way that it will adapt the campus to the future need of medical services. We are building today a 1 million square feet building, the Sarah Wetzman Davidson Tower. And we decided to put the operating room underground, 5 floors below ground level. So in any type of war, conventional, biological, chemical, we'll be there. We'll be ready in full operation.
What a tragedy that such measures are necessary in this day and age. You would think that with technology and education so clearly available worldwide, that rational people would implement intelligent solutions to the problems in the Middle East and, of course, everywhere else.
You know, I'm not a politician, and what you said, it's what everybody feels. But at the end of the day, emotions control rational. And what we experience today in the Middle East and Israel, we don't feel that we are near to a solution. So we at the hospital have to take our measures. We have to be prepared. We have to train our doctors and nurses. We have to do drill after drill after drill in order to be ready at the time when it will be needed.
Why is the Hadassah Hospital, if I may ask you this question, so world famous? Why is it? What's unique about your hospital?
What is unique about the hospital is, first of all, we were the first. We really introduced academic medicine to Israel. And we are still the first. Every year we introduce different type of new procedures. Just last month we introduced the first cyclotron into a hospital, in which it's a small nuclear generator that helps to provide nuclear material for diagnostic of specific diseases. We were the first to introduce aortic valve replacement via catheterization, and more and more and more. So this is one thing. The other thing is we are fighting for coexistence within the hospital setup, in which we are a humanitarian organization. And every patient, the minute he crosses the door, we don't ask what you did, where you come from, and what is your political view. We treat patients, terrorists, Arab, Jews, Turkish terrorists from the flotilla. All those were treated by us as part of our concept, belief, and spirit.
Would a hospital in an Arab country do the same?
I mean, I'm not the person to be asked we never experienced it. I mean, doctors are doctors, but hospitals sometimes got some sort of instructions from authorities, and it's built upon, many, many years of beliefs and culture, and the Jewish culture, and the Hadassah spirit, and the hospital education along so many years brought us to this point in which we feel that we would like to treat whoever in needs, in Israel and outside Israel. I'm sure you heard about the mission of the Israeli doctors and nurses to Haiti.
Absolutely,
this is
yes.
one example. And we have missions to Ethiopia.
They were actually the first hospital
Africa.
that actually arrived in Haiti, correct?
Absolutely, because in Israel, the doctors called me and said, Shlomo, tomorrow we are leaving to Haiti. It's first priority. And we took care of his patient and his responsibility in the hospital, because he volunteered to go abroad in the name of Israel, in the Israeli military and the Hadassah hospital. And this is first priority. This is why we were there first. And in the first 2 weeks, we were the only game in town.
In the course of your career, have you experienced that the Arab neighbors are realizing more and more that how the achievements of the State of Israel progress and move forward, and where they are staying perhaps in a kind of same situation? Are they becoming more educated and realizing that more could be achieved in mutual cooperation and peace by looking at the model of the achievements of the State of Israel?
I must tell you that they look to Israel and they come to Israel and they experience the ability that we have in Israel in order to treat them. We have a special program because we believe that they have to build their own infrastructure. And when I say they, I mean the Palestinians in Gaza and in the West Bank. And we have special program in which we are training Palestinian doctors in our hospital out of our donations. Some donors took it upon themselves to help them to build their own infrastructure by coming to Hadassah, spending between 1 and 6 years in our hospital. And then they go back, and we continue to collaborate with them. So they know exactly what we have. They know exactly what we can offer. And they try to build their own system. But unfortunately, because of the politician, because of the extremers, they can't do it. The average Palestinian citizens would love to be treated in Israel, in all hospitals, especially in Hadassah.
I don't blame them, but my question is, cumulatively, do these individuals who experience what Israel is really about, does it help? Are they getting it? Are they understanding what Israel is all about? And is it promoting peace in some way?
You know, we believe in our mission statement there is a line that we would like to be a bridge to peace. But I'm not naive. I mean, it helps. They come, they experience our attitude. They are very thankful when they go home, but they are not allowed to talk in public about their experience.
Unfortunately.
That's life.
Before we conclude, sir, I'd like to ask you to tell our audience, what are the challenges for the future? What are your plans for the future of the Hadassah Hospital?
What we have today in order to be ready for the future is really to complete the Sarah Wetzman Davidson Tower. This is the infrastructure for the future. So we are not waiting for the future, we are building it.
Sir, it's been a real pleasure. I salute you for all the wonderful work you're doing for Israel. Thank you very much, sir. Appreciate having you here.
Thank you.
This concludes our special show on medical research in Israel and in the United States. I'm Richard Peretz. Thank you for being with us.